So, hello everyone. Very good evening to all of you and welcome to this webinar organized by the IMT Alumni Association and Healthcare India. I'm Utkarsh Haryana, a student of IMT Ghaziabad, batch of 2022, and I'm currently doing my summer internship at Healthcare India as a marketing intern. Firstly, I would like to thank all of our viewers for taking out the time to join this session on how to effectively own your health and learn about the practical tips and tools that one can utilize to live a healthier lifestyle in this difficult pandemic situation. So today with us, we have Dr. Vikram Venkateswaran, founder and editor of Healthcare India. He's a doctor turned technologist who graduated from MCODS Manipal in 1999 and then went out to complete his MBA from IMT Ghaziabad itself from the batch of 2007. He has worked with major healthcare systems in India and abroad, as well as a management consultant for the last 20 years. Dr. Vikram has also been recognized as the top 50 healthcare strategist by Medgate today and serves on various industry committees like FICCI and ASSOCHAM. His debut book, Own Your Health, was recently released in Amazon and is currently in the top 10 bestsellers for holistic medicine. We also have with us Mr. Debashish Das and Mr. Vikram Shah, who are IMT alumni from the batch of 96 and 1988 respectively. Now, I would kindly request Dr. Vikram to take the floor and guide us through this exciting and engaging session. Thank you.
Thank you, Utkarsh, and a very warm good evening to everyone. I wish we had met in better circumstances, but it is what it is. And I was watching a movie a few days ago, a very confusing movie, and it's called Tenet by Christopher Nolan. I never understood what happened throughout the movie, but one of the key characters kept saying it, what has happened has happened. So even for us with COVID, what has happened has happened. Let's see where we go from here. Today's session, I'm going to just talk about a few things that we should take care of. I'm not going to prescribe any medicines which is illegal anyway. And I'm not going to talk about management of active cases or serious cases because that is best left to the doctor in charge. But what I'm going to leave you with is certain best practices that I've understood and what I have helped other patients manage themselves as well. So I'm going to talk about some of those and share my perspectives on those. Utkarsh has covered my background. And just for the crowd, just to be clear, I also have a day job. I'm a director with Deloitte. But here, what I say does not represent anything that Deloitte says. I do not represent them right now. And in my day job, obviously, I also do new product development for Deloitte. But when we look at management consulting, and all of us are, MBAs here who've been through the entire rigmarole of management education, I would treat COVID-19 as a black swan event. And those who have, read the book Black Swan by Nicholas Nissim Taleb, or at least understood the concept, what it means is an event that has never been predicted or even anticipated by anyone, right? There are organizations that do scenario planning, they do wargaming, and they prepare for various scenarios, floods, fire, epidemics. But an epidemic of this proportion, nobody has planned. So I think the first and foremost for us to understand is that COVID-19 is a black swan event, and there's no point in blaming ourselves for anything that is happening right now. This was not predicted. I think the only organization that kind of predicted this correctly was Wimbledon, because they had an insurance policy which insured them against the financial liability in case an event was cancelled. And that's the only example I can think of. There are so many other large and small insurance companies, business organizations, governments that did not plan for an epidemic of this scale. Not at this scale, right? We plan for local epidemics, but not at this scale. So COVID-19 is totally a black swan event. And what it means is it has derailed our way of life. And there's nothing we can do about it. So the first and foremost thing I want to leave you with is when you're in a black swan event like COVID-19, I think we have to just accept it and move on. That's a new normal. And this new normal is going to be here to stay for a while, right? So let's not worry about, hey, how did this happen? Could this have happened? Was this a biological weapon? Was this an experiment gone wrong? Could we have seen this coming? No, you couldn't have. No matter how many correlations are made with the Spanish influenza of 1919, I think it's very, very difficult to have predicted something of this sort to happen. I have an analogy for what we're dealing with right now, and it's got to do with the 6 years I was in actual clinical practice before my MBA at IMT, and the time I spent since then working with large healthcare systems, looking at patient behavior or patient experience, whether it was the UK, US, Holland, Germany, or even in India. I think the first sense we have when we think of COVID or we talk of anything close to COVID is panic. And I have a very simple analogy for this. Those of us who learned swimming, or at least attempted to learn swimming, I think the first lesson that the instructors tell us is don't be rigid, don't hold tight, just relax in the water, because naturally the body floats in water. I think what's happening today, and this is a message to all of our friends who are live and who are going to be watching later, is that if we panic, if we worry too much, stress too much, the outcomes are going to get worse. This is not a time to panic. Whether you are, even if you're not infected, you're safe, but you're worrying whether you will get infected, I think there's no point to panic. What you can do is take some countermeasures. And I'm going to walk you through some of them. They are systematic countermeasures that you can take that will help you not get infected. Your best strategy right now, our best line of defense, is not getting infected. I'm repeating that again and again. I mean, if you can get infected by vaccination, that is, you purposely inject an antigen, whether it's an mRNA, live virus, or dead virus, depending on the vaccine brand that you're taking, I think that is the best outcome out. But till then, evading infection is our best strategy. There's no other strategy. I mean, there's so many people who are thinking of, okay, if I'll get COVID once and I'll have antigens and I'll be immune. No, it doesn't work that way, because we really don't have literature to study COVID-19. You see, COVID-19, MERS virus, the SARS virus, they're all sisters. They belong to the same family. In all my years of clinical practice, and also the time I spent at Manipal, which has a very, very strong virology center, we've never tracked this virus because it never infected human beings till very lately. So it is a very unknown kind of entity. We don't know much about it. And because we don't know much about it, there is no guarantee that if you follow any of these crazy strategies that come up in Google or WhatsApp, that it's going to work. So your best strategy is not getting infected. And whatever you do to not get infected should be followed, right? Whether, I mean, the straightforward things like don't go out, wear a mask, wash your hands, don't aggregate in public, maintain social distancing, etc., etc., etc. And those are the only things that will keep us here long enough for the vaccine to catch up with us and for us to get the vaccination done and for the virus to stabilize. Because right now, even if you get infected, and God forbid if you need hospitalization, we have found out that the prognosis is not very good, and especially in the second wave, the prognosis has been very bad. Second thing is, I would seriously recommend to shut down social media. I mean, there's absolutely no good coming out of social media right now. Especially, I mean, I'm sorry to use the word Google University, but that's what I call it. My colleagues in the healthcare industry have been battling this university for a long time, since the advent of internet and search engines. They're patients who read up on a certain symptoms and come back and try to do differential diagnosis. Medicine is an art and science. It's art of how you communicate and how you treat the patient. But it's a science how you go about the differential diagnosis. A simple thing like a headache has 150 causative reasons, which could be a differential diagnosis for a headache. And then you do correlation and multi-factor analysis with other symptoms. So there is no way that some smart guy on the internet who did some research on his own has found out some ancient text and found something and it's going to work. So what social media is doing right now is increasing the panic. It's increasing our fear. And it's very important to shut that down. The other thing is, there's nothing else happening in the world. And really the media folks have nothing to report on. There's absolutely nothing happening. And so they're trying to do their job by filling the pages with some information which they think will be useful, even if it's obscure or abstract. And what it's doing is adding on to the confusion. It's really adding on to the confusion right now. I have had people asking me whether the vaccination is good. I have people asking me whether this was a deliberate plan by the government to do various things. There are all kinds of theories floating around, conspiracy theories, biological weapon theory. I think there is merit in trying to understand what was the causation, but not at this stage. Not at this stage, and not at this stage of creating panic. This is a very important slide, and I want everybody to pay some attention to it. A lot of people feel Indian healthcare system really sucks, right? It's really one of the worst healthcare system. Nothing happens. We don't have a basic EMR. We don't do this. We don't do that. This graph I purposely used a World Bank source graph so that people can't say, hey, it's biased. It's by Government of India. It's by Niti Aayog, or it's by Ministry of Health and Family Welfare, or ICMR for that matter. This is a graph that is taken from the World Bank. And I've heard all these theories that, our ancestors, our parents, our grandparents used to be so strong. They never had an issue. We are having an issue. Well, there was a reason for it, Quite frankly, your grandparents, a lot of our grandparents won the lottery because in their generation, it was very common for 1 or 2 children to die before the age of 5. And we call it infant mortality and under 5 mortality. And that has reduced tremendously in India. So much so that our life expectancy has gone up on an average. It used to be around 41, 42 in 1960s, and today is around 70 years of age. What that also means that we are growing up with a lot of weaknesses that are inherent. A lot of these children used to pass away because they were not strong enough to survive. Survival of the fittest. But with modern medicine, application of new technologies, hospitals, healthcare really spreading up far and wide in India, the life expectancy of Indians has gone up, which also means our ability to combat some of these inherent conditions like the virus is exposed is low. And it has remained low, and I'll discuss some of the reasons why this is happening right now. There was a theory during the first wave that, the Indian phenotype was very strong and resist the virus. Unfortunately, that is not true. And that is not true because of our environmental factors. We have 6 seasons in India. Right? We are one of the few countries where you have 6 seasons. And with each season, there's change of topography, change of vegetation, change of weather. And with all of that comes upper respiratory tract infections, which is what COVID is affecting right now. Also, our air quality isn't one of the best. Actually, if you look at the 10 top most polluted cities in the world, 5 or 6 of these are Indian cities, right? Including Delhi, which suffers the most. So overall, though our life expectancy has gone up and it continues to go up, the challenge is that our ability to lead a normal functional life from a foundational health perspective is like, and that is the causative reason why we see a lot more mortality in the second wave. Though the first wave was kind of mild for us, the second wave has taken much stronger because those who got infected in the first wave or at least battled some kind of infection in the first wave, if they got reinfected in the second wave, the chances are their mortality rate was higher. And that's because foundationally, a lot of them had inherent issues which were not addressed over the course of their life and which was exposed during this pandemic. Now, this has got nothing to do with our healthcare system. Our healthcare system is not the best in the world, right? It's probably one of the more average ones. We spend very less. We spend less than 2% of our GDP on healthcare. And our results are very obvious, on any parameter that the WHO takes, beds per 1,000 population, number of doctors per 1,000 population, or number of nurses per 1,000 population, we are one of the worst. So it has got nothing to do with our healthcare system, which is not the best, but our healthcare system, especially the primary health system, has improved so much that our average life expectancy is gone up, but not fully functional. So that is an inherent weakness that we carry with us, right? The next message I want to give is please get vaccinated. There is no way to get through with coronavirus without vaccination. Whether you take Covaxin, Covishield, I think Sputnik is getting approved very soon, and a host of other vaccines are coming in. I was shocked to find out that there were doctors in my batch, in my medical college, who had not taken the vaccine, though they were eligible as frontline workers right now. There are still a lot of senior citizens who have not taken the vaccine. Actually, one of my classmates, Tapan Jain, I don't know if he's on the call, He from IMT batch of 2005. He has done some analysis and shared on LinkedIn today. Very fascinating analysis. We vaccinated 10% of our population, and all that keeps getting repeated. Hey, we vaccinated only 10%. We should have vaccinated more. But our vaccination was only open to frontline workers, emergency care workers, defense, police, and to people above the age of 45. If we take that population, we've almost vaccinated 40% of our population, right? Because out of that people who are eligible, only 40% have taken the vaccine. So now you can understand the situation where, though our overall numbers look like 10, even those who are eligible, only 40% took. I know a lot of the defense personnel took the vaccine; they had no choice. But look at shocking fact that doctors and senior citizens who were eligible and there were no queues those days have not taken the vaccine. So my request to everybody who's listening and is going to listen to the recording later, if possible, without really going to a very crowded place and getting infected there, please get the vaccine done. Probably vaccine is the only thing that's standing between you and a very painful experience in the hospital, right? And there's nothing wrong with the vaccine. When we talk about vaccines, and those of us who work in the pharma industry know that there are two aspects that are important: efficacy and toxicity. Those are the two parameters. And one of the fascinating things about the vaccines, at least that are allowed in India, is the efficacy has been 85% plus. That means they have the ability to produce antigens to fight the virus. The toxicity is one thing that is impacting people to an extent. There are some side effects like blood clots in some cases, especially with one of the viruses, one of the vaccines, sorry. And also that there is, pain and inflammation and fever, etc. But let me assure you, the damage that COVID does to your lungs is immense. Compared to that, the side effects of the vaccines are much lower. Yes, there have been cases in which people have passed because their inherent structure was weak, and those cannot be avoided. Let's not forget these vaccines were produced in less than a year, right? On an average, it takes about 11 to 12 years to produce a vaccine, and that's a big silver lining for us that a country like India could produce a homogeneous Indian developed vaccine in less than a year, and so did the globe. All the other major pharma companies did it. So what takes about 12 years took a year. And I'm going to talk about some of the other upsides later, but it's important to get vaccine. There's no question, there's no debate. Any questions that are coming on the vaccine are totally pointless at this point because there is no treatment protocol for COVID. So if you get infected, there's not even a treatment regimen of it. So best is to get vaccinated, and with the 85% to 90% efficacy it shows, chances are your ability to develop COVID will be much lower. In case you do get infected, even after that, your ability to bounce back is much higher. The symptoms are very, very low. They're very mild symptoms after that. So there's no debate about it. And I request each and every one of you, get an opportunity. Please don't crowd around, but if you get an opportunity, I know a lot of apartment blocks are trying to get vaccine drives in their place. If you get an opportunity, please get vaccinated. Organizations are doing it. Apartment blocks are doing it. Please get vaccinated. There is no other way around it. The other interesting story I've heard is ventilation. Now, this came from a very famous study that was done by, I think, WHO or somebody, that said that virus is airborne now. And we've been saying this for years, for months at least, the virus is airborne. Now, seriously, that's scientifically correct. The virus is airborne, and because it's spreading through droplet infection. So you need to be within a 1 meter radius of a person having COVID. And you need to stay there for a while, like 10-15 minutes at least. And also, if you're in a very crowded place with many people who are infected, chances are you'll get infected, right? Because of the lack of circulation, the crowd, the proximity to these people. That doesn't mean the virus is floating in the air and will come inside your house through your balcony. That's not going to happen, right? There was another story also, that theory that somebody said, and it's trending on Twitter today, that the protein spikes are being shed by those who got vaccinated, and that can cause COVID. Please, that's not happening. These are all very fascinating theories, but it's not happening. And this is not the time for these fascinating theories because you're dealing with people's lives. So when I talk about ventilation, what I'm saying is keep your doors and windows open, because even if the virus does enter through somebody who's maybe infected, the chances are that it'll just pass through and not hang around, right? It's very important that you stay well ventilated. One of the challenges we see in India is too much of claustrophobia. too many buildings close to each other, especially houses in close proximity with very little circulation, and those becomes epicenters for spread. But so as far as possible, if it's feasible, keep your windows open, let the circulation pass through. Don't keep it closed. If you keep it closed, things get worse, right? So, so what can you do? I mean, you might say, hey, Vikram, this is great. This is fascinating. What can we do? So one is trust. All of you have these devices. These are standard, very important devices. Pulse oximeter, the thermometer, and the BP monitor. I would also recommend a glucometer for those who are diabetic. See, there is a lot of correlation between diabetes and COVID, right? It seems the COVID virus thrives better with people with high blood sugar or blood glucose levels. Now, why is it? I don't know. We don't have we just have correlation, not causation. When I say correlated, I mean there are two observations that are correlated: people with diabetes, high blood glucose level, and people who have COVID. But is the one causing the other, or how is one influencing the other? We don't know as yet, right? But there is a good possibility that if you are diabetic and your blood sugar is not controlled, the chances of contracting COVID are higher. Similar studies have found that if you have high blood pressure, and this has been true of 25 to 30% of the cases in the US, if you have high blood pressure, chances of contracting COVID are high. So important to keep your blood sugar levels in check, important to keep your blood pressure in check. It's very important. Right? The pulse oximeter, very useful. There are also these watches, like the one I have, it has a pulse oximeter, but I will not recommend those. I'll recommend get a normal one. And please get a thermometer, because in case you have to really rule out temperature, thermometer is the best way. I was still surprised to find out that there were so many people who did not have these basic things. It's very important to keep them. I think Omron has a very good, blood pressure monitor. I think that can be used, and I think there are devices available on Amazon as well. So please get these devices if you don't have, because this will really help you prepare for any eventuality, especially for an important time. The other interesting thing I've been reading about is oxygen concentrators. So there's an absolute panic buying of oxygen concentrators, and large device companies have been selling them 5 liter and above, 90% and above. And an oxygen concentrator can cost you anywhere between 65 to 70,000 rupees plus, right? I would not recommend going and holding an oxygen concentrator, because it probably will not be useful to you. God forbid if you develop it and it becomes a very extreme case, maybe. But over a long time, it is not a very useful investment. Rather, I would recommend, if those of you who are very serious about it and say, okay, I need some line of defense, invest in a nebulizer. A nebulizer is a standard issue. I mean, if you have kids with asthma, or you had asthma as a child, you would remember this. It's available in every doctor's clinic. And essentially what it does is it throws up a few medicines to keep your nasal passage potent, so that you can breathe during an asthmatic episode. A nebulizer is very useful in case you want to attempt easy breathing, especially for those who are showing very mild symptoms, right? You don't need any medicine. You just need to switch it on, plug it on, and breathe through it. It really helps you breathe. It really clears up the passageway. And that is a good alternative rather than holding an oxygen concentrator, which can save somebody's life. Today, the order value of oxygen concentrators in the country are running in lakhs, and the delivery is in thousands. So there is a huge mismatch. But the first priority, according to the government, is the hospitals, large health establishments, and those with morbidities, etc. And those are the orders that are getting fulfilled. So I will recommend not crowding around oxygen concentrators, but focus on something like a nebulizer that will really help you and can be used in the future as well. It's very useful for asthmatics, or in case you are having nasal congestion or difficulty in breathing. Your oxygen concentrators is used in very severe cases of COPD, which is your congestive pulmonary disease. And it is not a standard issue thing. And I've tried figuring out that if you buy an oxygen concentrator, can you do oxygen therapy later all by yourself? Well, it is not really useful. There are no effects, no beneficial effects, and there might be some side effects because of the oxygen cutting through your nasal passage for a normal patient. The other thing you've got to prepare for are supplements, and I'll explain why. I think the when we talk about supplements, and I'm okay if you can manage this with your diet as well. There is a lot of correlation between the lack of some of these key vitamins and minerals and fats to COVID, especially with zinc. Zinc overall boosts our immunity. So you would see that those who are higher on zinc or have a higher bloodstream value of zinc, they are usually more resistant to upper respiratory tract infections, because zinc really helps us to maintain the potency of our airway. The similar issue or correlation has been found between vitamin D and COVID. A lack of vitamin D causes structural issues, and again, those with low vitamin D have been prone to develop COVID as well. So vitamin D, zinc, vitamin B complex, omega-3, and vitamin C. These are supplements I will definitely recommend, especially if you're vegetarian or vegan and you're listening to this. Vitamin B complex and omega-3 does not come from vegetables. It doesn't come, and it comes from milk products to an extent. But if you're vegan, you're absolutely zero on it. Our body cannot produce omega-3, though it can produce some vitamin B complex. So I will recommend taking some supplements. These are over-the-counter supplements. Vitamin B complex and vitamin C are water-soluble, so it doesn't matter how much you take. Vitamin D is not water-soluble, and omega-3 is also not water-soluble. But these are available over-the-counter, available on Amazon as well. So I would recommend during this next 1.5 to 2 month period, just take some supplements. Ideally, you should get yourself tested and see how your levels are, and then take supplements. But taking a test right now is too much of a risk. So I'd recommend just go ahead and take the supplements and make sure that your immunity is slightly fortified. It's very important right now. Vitamin D especially, and I'll explain why in some time. The other thing is, COVID is an upper respiratory tract infection. You have to have a very strong upper respiratory tract system, which is a very strong breathing system. So in hospitals, what happens, people with chest conditions or with lung conditions, they are taken through something called chest physiotherapy exercises, which is essentially, breathing in and holding your breath for a while, and then see how long you can hold it, and then releasing it, and doing some 10 reps of it, and about 3 times a day. And this really helps the patients improve their lung capacity, their vital capacity. Now, a similar exercise is very important. This is recommended by physiotherapists as well as doctors. I saw a doctor from Vedanta really talking about it in a lot of his videos. I think he's on the right track. He's onto something. Even if you're not infected, not showing any symptoms, very important to start this chest physiotherapy exercises. It's very critical, because it not only enhances your airways and your lung capacity, your vital capacity, but also it helps you combat in case you get infected. The other option to do is, if you're doing yoga or you're doing pranayama already, that is a very positive thing as well. Whether you like yoga or you don't like yoga, I know there are so many philosophies that it can't help, it cannot help. One thing we all understand is breathing is essential. Whether even if you're not a follower of yoga, breathing is very important. Whether you work out, whether you play, how you pace yourself, those who run marathons, your breath intake, outtake, managing that is very important. So breathing exercises are key, and I would recommend everybody to start it. I do it every morning, whether even before COVID I was doing it, but now I've started doing it very consciously, because it really helps us increase our lungs and strengthen them further. Other measures, in the olden days, we used to have a family doctor. This guy, this doctor will know everything about you and your father and your grandfather, and he doesn't need a medical record or any longitudinal history. He just remembers it in his head. I think it's very important to make sure if you have a family doctor, keep in touch with him. But if not, then identify somebody, because 80 to 85% of the cases that do get infected are treated at home. It's home quarantine. That's the protocol that is being followed by every state government and also recommended by ICMR. If you're doing home quarantine, they will assign a doctor to you from the government or from some hospital who will be through telemedicine, will be in touch. But also good to have your own doctor handy, because with your own doctor, you can run through some of these procedures and get some valuable advice early on, right? The other two things that are really helpful, and these have been age-old systems in India. One is saline water goggles. When I was in my clinic, I used to always recommend patients doing saline water goggles, because saline salt in water has a magical effect on the throat. And salt is a very good antiseptic. It is really very difficult for a lot of the microorganisms, especially bacteria and fungi, to stay in the mouth in case you're doing saline water gargles. And in preliminary studies, it is found that the coronavirus, if it directly doesn't enter the lungs, it goes through your nose or through your mouth. It stays there for a while. So if you're doing saltwater gargles, chances are you neutralize it in the mouth itself. If you have mild symptoms or you're mildly infected, very effective as a home care method. Same for steam inhalation. Very important to make sure that you are regular with it. At least do it once or twice in a week normally. And in case you have a mild symptoms or you're mildly affected, it's very important to do it. Now, these are things these are all measures you can take even before you get infected. All that I've told you so far, you don't need to really run around anywhere talking to doctors or buying remdesivir or any of those medicines. Right now, the stage at which we are, the vaccine production is catching up. We just have to be patient for a while and all of us will get vaccinated. But till then, these measures are enough to hold out for you. Now, for anybody who is really serious about following a regimen, I would only recommend the regimen that's coming out of ICMR. Indian Council of Medical Research, along with All India Institute of Medical Sciences, is putting out an algorithm. They update it almost every week. This is an update from May 22nd or 21st, sorry. It's yesterday's update. The link is here. If somebody's curious about it, I will send the link separately also. So they have divided into mild, moderate, and severe. The moderate and severe, I don't want to talk about it much because in most cases you get admitted. For a moderate disease, you get admitted in the ward, and for a severe disease, you get admitted in the ICU. But for somebody having mild disease or a mild symptom, it's a classic series of steps that ICMR recommends, including the medicine and the dosages. I think this is one chart which is very handy to keep, and it's the only protocol prescribed officially by the government. Those of you who don't believe the government is right and ICMR is just clowning around, that's fine. WHO has a similar algorithm, right? It is slightly favoring the large big pharma, it's slightly Western oriented, but pretty much talks about the same kind of steps. Though the medicines are those who are available in the US or Europe, and for the Indian medicines, you might have to Google and figure out if I can get a generic variation of it, or use the ICMR dosage if useful. I will send this out. I'll make sure Pallavi sends this out to each one of you on the call, as well as those who registered for the webinar. This is a very handy document, and it gets updated every few days. At least once a week it gets updated. So please follow this in case of any protocol. Now, the other things what you can do, India got into this mess. Sorry. So British Medical Journal came out with an article. I think it is the best article I read on COVID, which said that the seeds of COVID were laid about 5-6 years ago. And he talks about a lot of things. The author talks about a lot of things that happened in the world, including all the tension in Venezuela, in Ghana, in Syria, and how the public health system has totally fallen apart in many countries, helping them become epicenters of future spread. And it is a very fascinating study. It also talks about environmental pollution, sustainability, global iceberg melting. So it talks about a lot of things. But one thing that was very fascinating in that study, and which I can correlate to India, was they felt that the global rates of people doing exercise had gone down. So I did some research on my own, and which I published in my book as well. And we realized that almost 60% of India does not do any kind of exercise, right? And this is a study done by one of the healthcare agencies. And what that means is that overall, our ability to do physical activity is low. And it is getting further worse now because of lockdown and work from home and quarantine. You are not able to go out anywhere. So their physical activity is almost down to zero. Now, why does that impact us? It has a direct impact on our immunity. It has a direct impact on our respiratory system. And whether you feel you're strong or you're immune and you feel that you're okay, there have been many cases where people thought they were strong, but they found out the hard way, right? So exercise is very important. And a lot of people say, okay, there's no space, there's no time, I can't go out, there's no motivation, etc., etc. So you need 150 active minutes per week. This is WHO recommendation. You have to get 150 active minutes per week. And you can do it at your own house. You don't need to go out anywhere. You can't just say, hey, Vikram said, I need to get 150 active minutes a week, so I'm just going out for a jog. I'm not saying that. You can do that at home. You can do it anywhere, but just make sure you track it. The more you track, the better it is, because if you don't track, you won't know, right? For those of you who feel there's no space, I thought I'll leave you with a visual image. They say picture speaks 1,000 words. Now, this is the cell of Nelson Mandela from Robben Island. And the reason he was given this 6x4 cell was to break his spirit and break his body. He was not allowed anywhere outside. He was not allowed to speak to people. His meals were kept in this cell as well. And what Nelson Mandela used to do is every morning he used to wake up and do 45 minutes of spot jogging. 45 minutes of spot jogging so that his body could eventually come out, become the president of South Africa, and fulfill a vision that he had in his mind for ending of apartheid. So while the spirit is high, the body needs to follow. Same for COVID. Even if your spirits are high, the body needs to follow. For the body to follow, it has to do some kind of exercises. A quick word on the high-risk categories. Diabetes and hypertension I've already mentioned. People with cardiovascular diseases that are at a high risk too. And this is primarily because the circulatory system is weak. When the circulatory system gets weak, there are increased chances that the immunity will go down. The body's ability to defend itself goes down. Also, don't forget that the first line of attack against COVID is usually steroids. And this is given because COVID uses our own body's mechanism to act against us. So it almost resembles autoimmune disease. And to suppress our own immune system, we give steroids. And steroids will further suppress your immunity, which in cardiovascular patients becomes a big problem. So those with cardiovascular conditions, they really need to watch out, because the chances are that the whole protocol of treatment right now, the way it is defined right now, will go against you. So again, best line of defense, don't get infected. I need not say more. 70% of Indians are deficient in vitamin D. This came out in a nutrition report this year. And now that we are not going out at all, I'm sure that number will be much higher. And the other crazy number that's really worrying me is the mental wellness number. It is estimated that 7.3% people declared that they had mental health issues. Now, as I say declared, I mean, there are a lot of people who will never admit to it and they kept quiet about it. But 7.3% people said that they had mental health issues. The number is expected to go up to as high as 20%. So one of my last slides, it's very important to keep a positive spin on the whole thing. No matter what happens, this is not the worst human race has gone through. I mean, if you go through the history of pandemics, right from the plague of Justinian that happened in the Roman Empire to something as late as 1830s France, which most of the population of Paris got wiped out because of cholera, to the bubonic plague that used to eliminate 50% of the population of Italy every few years, to the Spanish flu, which just happened 100 years ago. I think our response this time has been much better, right? So there is a very, very positive and big possibility that you'll come out of this. All you have to do is think positive. Yoga really helps. There are a lot of helplines that are available. A lot of organizations are running helplines. Take advantage of it. One of the biggest beneficiaries of COVID was telehealth. And today you can do a telehealth consultation anonymously. So I will recommend just don't let the pandemic get to you. It is going to end. It is not going to be the normal. It is going to end eventually. So all you have to do is keep your wits about you, think positive, pick up hobbies, do things, produce output, and stay positive. So with that, I'm done. Thank you for your time. I've taken about 40 minutes because I thought I'll leave some time for questions. It was a pleasure talking to all of you, and I'm happy to take any questions.
So we have received a few questions. I will just start with them. So the first question is, what about the current crisis worries you the most, and what gives you the most hope?
Yeah, what worries me the most is when social media and digital media came out and World Wide Web became such a big phenomenon, I was so positive because I thought there's a lot of information now and we can do wonderful things with information. But in about 10 years time, all that is turned to garbage, right? There's a lot of junk information that's coming out. So I feel there's a lot of panic. There's a lot of anxiety created by all these media channels and social media and digital media. And in the pandemic, it's getting worse. So every day you keep hearing about reports, analysis. Now the latest trend is black fungus, which is supposedly another epidemic of within the epidemic. So this is how things are going, and this is how the media is projecting. But on the positive side, right? I think there have been some phenomenal leaps that India specifically has made. Right? From a management perspective, look at us. We are all MBAs and we go to offices. Most of us are in senior positions. And we've always believed that work from home is not possible. The output is not good. You need to come to office. People need to be watched. People need to be coached. You need FaceTime. But for the last year, so many of us are working from home. I don't think the productivity has gone down. The output has gone down. As a matter of fact, people are working longer hours now. So a few myths like work from home doesn't work, having the future of work does not depend on location. That's clear. That debate is over. I think digital transformation has received the biggest benefit more than any CXO strategy or CEO strategy or any brainstorming or board events. I think COVID was the biggest driver for digital transformation. I think all the digital companies are doing well. Organizations are adding more and more digital features. And last but not the least, I think healthcare in India has received a big boost. It took us 15 or to 20 years to get telemedicine out of the door. According to a Madras High Court ruling of 2008, if I'm not mistaken, telemedicine was a crime. You cannot prescribe medicines on telephone or Skype or whatever. And it took us less than 48 hours to pass the guidelines. We had Janta curfew on 23rd, and by 25th, we had passed the telemedicine guidelines, which took 20 years before that. I think mental wellness will get a big boost now because of telemedicine, because you can do anonymous consultations. So while there have been a huge debate on the anxiety levels and the panic and all that is being created by all the social media and digital marketing channels, on the positive side, I think we have settled the work from home debate. We've settled the workforce of the future debate. We have settled the telemedicine debate. And we've also settled the fact that digital transformation is here to stay. And it is the only thing keeping businesses running. And look at the reach of organizations like Amazon just because they were digital, as compared to brick and mortar companies, which is almost zero now.
So the next question is, if I get sick from COVID-19, will it affect the outlook of my cancer?
Yeah, that's a lot of research going on. Whether see, cancer is a condition, right? It's not like a disease. It's not classified as a disease. It's considered a condition. The body's cells start enlarging and undergo hyperplasia, become immature, and start, depending on the stage of the cancer, can metastasize in other parts of the body or remain free flowing in the blood. Now, more or less, there is no conclusive evidence that COVID-19 makes your cancer prognosis worse. So far, there is nothing. But overall, the immunity of the person is depressed in case you have COVID-19, primarily because the way COVID acts is to use your own body against you. And also it kind of you use a lot of immunosuppressants like steroids to, and you use warfarin. Let me not forget platelet blood thinners like warfarin to reduce blood clots. Now, both of these actually depress your immune system. So though COVID-19 may not affect the cancer prognosis directly, my belief is that suppressing the body's immune system will make the overall response of the body against cancer slightly low. But again, a lot of research has to be done. This is one of the areas where a lot of activities there right now. So hopefully in the near future, we'll get to know more.
So the next question is it possible that the third wave could come out soon?
It will come. It will 100% come. Viruses are heavily, see, first of all, viruses have been on Earth, I think, longer than us. And they are survivors. They have great tendency to survive. They mutate very fast. They can stay as viroids or non-living objects for years, centuries, and then suddenly come active when the right time comes. And they are least understood. We don't know viruses very well. We are still doing a lot of research. Bacteria are easier to understand, so are protozoans, but viruses, they're a different ballgame altogether. My belief is not third. I think there will be a fourth wave also. And there is a belief that the third wave will affect children more because they wouldn't have gotten vaccinated by then. And the fourth wave, we don't know. We don't know as yet. So the first wave was mostly people above 45. Second wave, I think the mass brunt of the casualty has fallen on people below 45. The third wave is supposed to be children. Fourth wave, I don't know. So I have a feeling that this is here to stay. It's a year and a half long battle going forward. So it's important to take countermeasures and stick to them. And one thing that's positive is that the vaccines are working. The vaccine production is working. The industry has really responded. It is, it's at the end of the day, no matter how much you use them, it's the industry that responds. All the management consultants and MBAs and everybody in the industry has responded, whether it's oxygen, remdesivir, ventilators, oxygen concentrators, vaccines. The industry has responded. I hope the healthcare community can hold it together. My bigger concern is the number of doctors and nurses. They are suffering from big burnout. Dr. Devi Shetty talked about it a few days ago as well. I hope they have it in them to take the fight on for the next wave. They have activated final year students, both for nursing, PG, MBBS, etc., to come out. I think that's a very good move because that really boosts our reserves. If the doctors can hold it together and avoid burnout, and the nurses especially, I think the industry is already there to combat this, and we should be able to ride out the third and the fourth wave.
Dr. Vikram, hello.
Yes.
Yeah, Dr. Vikram, you had mentioned in your one of the slide about this ventilation. My question is because it is already present in the aerosol form. So if I am moving out away or my doors and windows are open, if I am staying at some, say maybe at particular floor, 10th or 11th, and if one flat is positive, so how does it may affect through the aerosol?
It does not affect. It does not affect unless you're in a very crowded place along with these people, any person who's infected or a couple of people who's infected. There is no research, no conclusive evidence to show that it's flowing from one floor to the other floor, except in cases of HDP water. If your apartment block uses, sewage treatment plant, and you have recycled water that is flowing through your toilets, you might want to watch out, especially if there is a floor above or floor below that gets infected. That is the only cause of concern right now. Otherwise, flowing through air through an open window and door is not possible.
Thank you. Thank you.
So the next question is, what are the common side effects of the COVID-19 vaccine, and how much time will it take to build the immunity after you get vaccinated?
So immunity is you're not going to build immunity, you're going to build antigens. So there is a classic difference between building immunity and building antigens. Immunity is almost the overall strength of the human body to combat a lot of the symptoms and the conditions. Antigens are very specific against COVID-19. Now, the common side effects that I'm seeing with one of the vaccines, and I don't want to name them, with one of them, there are some blood clot issues, and there is fever, inflammation, definitely pain, a lot of body pain, and in some cases people are also getting nauseous. But they have been mostly localized. There have been a few reported deaths, especially in people with comorbidities. So that's where you need a doctor's analysis. There are people who've taken TPTs and CT scans and treadmill tests before they've gone the vaccination. So if you have comorbidities, I would definitely recommend take a doctor's opinion before you get the vaccination done. If comorbidities are not present, cardiovascular, you're fine, and there's no, the sugar levels are controlled, the blood pressure is controlled, I don't see a major issue, except for these minor symptoms, and all of them are symptomatically treated with, paracetamol and other things. But I have not heard of any major issues coming out of the vaccine so far. The only the larger concern is Sinopharm. Sinopharm seems to have a lot of side effects, and this is coming out of few of the tests that I knew of that were conducted in the Middle East. But luckily for us, Sinopharm is not allowed to be administered in India. So we were.
So the next question is, how long should I stay in home isolation if I have the coronavirus disease?
Yeah, so the good news is, I think yesterday or day before, we released the home test kit. the rapid test kit, though it has a high precedence of false positives, but it's still a step in the right direction. I don't see too much literature on it, but what I feel is if you have contracted corona, the minimum amount of time you should be in isolation is anywhere between 7 to 14 days. Depends on the protocol and what the doctors have been saying for your respective states. Each state is following its own protocol because health is a center and a state subject both, and each state is allowed to define their own protocols in case of pandemic as per the health ministry guidelines. But it's 7 to 14 days, and you have to get a test done again to show it's negative before you will come out, and it can't be a rapid test, it has to be an RT-PCR test.
Okay. So another question is, can you throw some more light on black fungus?
Yeah, that is, I think the Prime Minister Modi talked about it. So I think it's become a major concern. Now, black fungus exists everywhere, just like coronavirus did. Even the virus existed anywhere, except it was not attacking us. Black fungus or mucormycosis, it's in the soil, it's in the plants, it's everywhere. It's right around us. Now, fungus, I talked about bacteria, which are easier to deal with, in my opinion, and protozoans were also easy to deal with. Viruses are very tricky, but fungus is like an opportunist, right? What it does is it stays with you long enough, but the minute your immunity comes down, and those of you who've taken care of elderly parents or bedridden relatives or grandparents, you would remember they will come up with bed sores. So no matter even if they're bedridden, they will have to be cleaned or at least given a dry sponge bath every now and then. And this is to avoid bed sores or canker sores. Now, black fungus is almost like that. Now it's supposed to be an epidemic within an epidemic, because those who are treated with COVID and have been extensively doused with steroids, suppressing their immune system completely, are now falling prey to black fungus. So while steroid usage, I mean, we don't have much of a choice right now till the protocols are defined, steroid usage is being used, but steroid usage has to be done in moderation. And that's what we've understood. And if you moderately use it, at the same time, you have to make sure that the immunity picks up. If the immunity doesn't pick up, then the black fungus epidemic becomes a bigger challenge. And black fungus is very difficult to treat. It won't go away just like that. So that is a emerging challenge out of COVID. And for every epidemic and for every treatment protocol we make, all these microorganisms have a reverse protocol, and they have their own countermeasures. So I think black fungus is an after effect of our dosage of steroids. Hopefully, with increased vaccination, we'll have lesser infections. With lesser infections, or at least mild infections, if at all, then the usage of steroids are absolutely zero in that case, and this black fungus epidemic can be contained.
So the last question from the audience is, like a person has tested negative for COVID-19, but they are still having low-grade fever. The temperature is around 99.6 or 7, and the blood tests are okay. So what should be done in this case?
No, I think they should still take the precaution of wearing a mask and maintaining social distancing. But 99.6, 99.7 are fine. Please check, use a different thermometer to check, just in case the calibration of the thermometer is wrong. All these instruments have to be regularly calibrated, but those in our houses are never calibrated again. So that is one recommendation I'll have. Continue to maintain the protocols, and if you think that the fever is not going away, a low-grade fever, differential diagnosis, there could be so many other things, right? So it's better to consult a doctor. Better do a teleconsultation with your family doctor or any other doctor to get a differential diagnosis on. It could be another condition altogether. It may not be COVID.
So anyone from the audience, if they want to ask any question, they can ask right now.
Yeah, my question is this regarding because in most of the offices, these are centrally air conditioned. So how to, because say suppose any office is having a number of persons, maybe 20, 30, whatever it is. So how to deal with this, because proper ventilation may not be there in the central offices. So what is the recommendation of Dr. Vikram about it?
I don't think people should go to office. and even if they do, and it's absolutely necessary, I think there has to be a lot of distance maintained between various people. I think one of the reasons why we are seeing the second surge is because a lot of the offices were open. We had so many cases in our own office, and our offices were working for a while. So the air conditioning, as you rightly pointed out, is a big causative factor. Anyway, it was a big reason for people developing influenza and pneumonia and viral fever normally with a change of season. Now it's a bigger risk, if you ask me. And till we are at least getting closer to our vaccination numbers, I don't think the offices should open.
So if any person he has got both doses also, dose 1 and 2, so then also there are chances that he can get the infection?
Yes, because the efficacy is only 85 to 90%, right? It's not 100%. And as a matter of fact, everybody who's taking the vaccine now is a part of the stage 3 trial, right? Stage 3, stage 4 trial is going on. And all the data that is being collected through the vaccination is going as a part of the trial. So there are chances that you might get infected, but the good news is that even if you do get infected after the second dose, especially, the symptoms are very, very, very minor, and the recovery rate is very high. So overall, it looks like vaccine is the only way out.
Thank you, doctor.
So another question from the audience is that what happens if someone take two doses of Covaxin and take 2 doses of Covishield? What would be the repercussions?
You mean four injections and all?
I guess.
I don't know. I have not come across. I've seen cases where somebody's got Covishield and then taken Covaxin. These two are very different injections, by the way. They are not the same. Covaxin is a dead attenuated virus, while Covishield is a live attenuated virus. So they are. I think you will have a massive issue, if I'm not mistaken. I would not recommend that.
So I think we're done with the questions. And I would just request everyone to turn on their videos so that we can click a picture for the session. And then we can close it.
Excuse me, I have one question about white fungus. What is it about?
White fungus?
I heard in the news today about white fungus.
I mean, I've heard of the white fungus exists. It is a very common kind of fungus that grows, especially it infects your skin, especially in case of a patient not moving too much or bedridden patients. Black fungus is the one that's affecting a lot of the COVID patients. But white fungus, it's called candidiasis or thrush. It also happens in the mouth at times in case a person is not having strong immunity. And for that, there are anti-candidial, mycoderm and other medicines are there, which it is easily treatable. The black fungus is the more dangerous one because it doesn't usually affect people, but if it does, it's almost like an epidemic now.
Okay. Thank you.
All right. So thank you everybody for your time. It was really a pleasure talking to all of you. And hopefully I've managed to help you navigate these difficult times today.
Yeah, Vikram, thank you so much for the session. And on behalf of the alumni community, as well as the IMT community, I wanted to thank you because you did this at a short notice. And I know, there are various theories and various everybody is talking a different language in, social media, as you said. But the way you put the framework together and defined it into a structure is really remarkable. It is very helpful under the circumstances.